Greetings from Citizen Health and the Team Academy IAPSME Connect. And today, in the series of People's Health It Matters, we have Dr. Lina Bandopadhyay, who is a professor in Department of PSM, Advisor Public Health, All India Institute of Hygiene and Public Health, Kolkata. बहुत बहुत स्वागत है मैम आपका हमारे इस सीरीज में.
Welcome, madam. I'm here. I'm Dr. Lina Bandopadhyay, and today I will discuss on obesity. Obesity broadly refers to excess body fat, and this is in public health importance. इसके महत्वपूर्ण समस्या भी अभी होता है क्योंकि दुनिया भर ओबेसिटी तेजी से बढ़ रहा है. जो मोटापा ओबेसिटी और मोटापा जो बताती है वो दुनिया भर तेजी से बढ़ रहा है. तो हमारा इस पब्लिक हेल्थ प्रॉब्लम है. आजकल की जो भाग दौड़ में कोई लोग अपना शरीर का ध्यान नहीं दे पाता है. उनके लिए जो स्वास्थ्य और क्रियाशील जीवन देना है वो नहीं रह पाता है. इसीलिए दिस इज अ बिगेस्ट प्रॉब्लम एंड दिस इज कॉजिंग मेनी ऑफ द हार्मफुल इफेक्ट ऑन द बॉडी. तो इसके लिए इसके बजाय से हमारा जो डिफरेंट सर्वे होता है उसके NFH स्टडी में ये दिखा गया है जो 56% ऑफ द पॉपुलेशन ऑफ इंडिया मोटापा से पीड़ित थे 2018 में. सोचो कितने समस्या ये है. ये क्यों है? तब हमारे बॉडी के लिए द फैट इज वेरी मच एसेंशियल like that of carbohydrate and protein. हमारा डाइट में बैलेंस डाइट का जरूरत है, उसमें फैट का भी जरूरत है. बट एक्सेस फैट एक्यूमुलेशन जो होता है, जब चर्बी जब जमा होता है, इसीलिए क्या होता है, ओजन बढ़ जाता है. ओजन बढ़ने से वजह से हमारा आपके शरीर में वो पूरा रूप का बदलाव जाती है और उस अपने शरीर में बहुत रोगों का जन्म भी ले सकता है. इसीलिए हमारा जो एक्टिविटीज है उसमें उसको निदान, समय पर निदान और उपचार इसके लिए बहुत जरूरी है. समय पर निदान और उपचार
हाँ मैम,
मोटापा
जैसा
के रोकने है.
जैसा आज बता ही रही हैं आपकी मोटापा इतना घेर चुका है हम लोगों को कि नाउ-अ-डेज बीइंग अ स्लिम फिट पर्सन इज मोर इम्पोर्टेंट, मोर चैलेंजिंग देन एनीथिंग एल्स. तो टुडे वी विल डिस्कस अबाउट इट. हाँ, so
Yes.
how come one person can know that he is obese or not? Is there any criteria, or just with the physical appearance we can confirm it that he is obese or not?
So rightly pointed out, Ritu. Actually, for assessment of this obesity, we can measure the body mass index, BMI. How it is measured? By the height of the individual. If you know the height and also the body weight, there is some measurement is there. Weight in BMI, actually body mass index usually signifies that it's measures of weight in kg divided by height in meter square. So it will come some value, and that according to WHO criteria, if the value is between 18.5 to 24.9, then it's a normal. If it is below, then undernourished. That we will not discuss today, but we are more giving than towards the obesity. If it is overweight, if it is more than 25 to 29.9, we can say that the overweight. And if it is more than 30, we call it a morbid obesity. So morbid obesity is very much harmful for the body, and it causes many of the diseases.
Okay, can we discuss some of the diseases? Like we know that obesity is actually a harmful problem, and that is why we are trying to make us a fit person. But can we discuss some diseases related to obesity?
Obesity may causes the various type of disease, starting from diabetes. We call it modhumeho. That is due to, that the pancreas is secreting the insulin hormone, and that insulin hormone is very much essential for glucose metabolism. But the obese person, there is insulin resistance may develop. So the individual may develop the diabetes. Similarly, there is metabolism of lipid is also being hampered by the presence of the obesity that's leading to hyperlipidemia. We know there are two types of cholesterol in the body. One is the HDL cholesterol and it's the LDL cholesterol. The HDL cholesterol is protective for the cardiac problem and heart disease, but LDL, low density lipoprotein, that is harmful, and if it is increased case of obese person. So I will discuss the problem in three form. One is a medical problem, second is the psychological problem, and third is the social problem. So medical problem I have discussed with you, that is diabetes. Number two is hyperlipidemia, और लिपिड का लेवल बढ़ जाता है, और उच्च रक्तचाप, that is hypertension, and this cholesterol may also deposited on the arteries, and that may causes the hypertension. So this also causes the coronary artery block. Coronary artery is supplying the blood circulation to our heart. If the cholesterol or atheroma is developed within the coronary artery, it may causes that coronary heart block, and that causes the failure and also different types of cardiac disease, coronary artery diseases. Similarly, it may also affect the brain and causes the cerebrovascular accident. So hemorrhage, embolism, it may occur due to this hyperlipidemia. Another problem is very important, that is the females are suffering from the hormonal disbalance and PCOD, very common nowadays, polycystic ovarian disease. And this is due to the obesity, and this causes the multiple cysts within the ovary, and this causes the inhibits the ovulation, and ovulation nahi hone se, so later on these persons are going towards the infertility. That is a very biggest problem of PCODs patient. So obesity is leading to PCODs, infertility, and even in the pregnancy, if the patient is obese, that may leave giving rise to the baby of a of increased birth weight, and if it is more birth weight of baby, that also leads to obesity. So obesity may causes the medical, these are the medical problems. Then many other, the गठिया जो अर्थराइटिस होता है, वो ओबेसिटी के बारे में होता है, जॉइंट का ऊपर ज्यादा प्रेशर होता है, नी जॉइंट। अभी देखिए द नी रिप्लेसमेंट बहुत पर्सन का हम लोग सुनते हैं जो उसको नी रिप्लेसमेंट हुआ, तो ओबिस पर्सन दे हैव गॉट द मेनी अदर कॉजेस आते हैं, बट ओबेसिटी इज अनदर इंपॉर्टेंट कॉजेस व्हिच causes obesity. So these are the medical problem. If you got the psychological problem, the individual, those who are getting obesity, morbid obesity के बाद में क्या होता है, डिप्रेशन हो जाता है, वो लोग कोई मीटिंग में नहीं जा सकता है, स्कूल में जाने के लिए मन नहीं होता है, तो उसको सेल्फ एस्टीम भी लो हो जाता है, सेल्फ कॉन्फिडेंस भी कम हो जाता है, इसीलिए they are not attending any home, they are confined to the home, they are taking more food, and इसीलिए बहुत सारे प्रॉब्लम बच्चा को एडोलेसेंट एज ग्रुप में एंड ऑल्सो बच्चा को भी होता है. एंड द सोशल प्रॉब्लम इज, ये तो इंसान का नहीं होता है, इंसान के साथ साथ फैमिली में भी डिस्टर्ब हो जाता है, फैमिली में प्रॉब्लम होता है, एंड उसको बाद में सोशल प्रॉब्लम, जो सामाजिक जो प्रॉब्लम होता है, समाज में जो प्रॉब्लम होता है वो भी बढ़ जाता है. So these are the problems which you're facing due to the morbid obesity.
ओके मैम, ये एज स्पेसिफिक है या किसी में भी? अब क्योंकि पहले तो ऐसा था कि 60 से ऊपर या कुछ 50 से ऊपर एज पे होने पे और धीरे धीरे इंसान ओबीज होने लगता था, बट अभी ऐसा भी हम देख रहे हैं ना कि बहुत सारे बच्चे भी
एनी
ओबीज
एज.
इन एनी एज ना, तो इसको ठीक कैसे किया जाए मैम?
ऋतु जो सवाल, हाँ, ऋतु जो सवाल पूछा है बहुत बढ़िया सवाल है. इसमें क्या है, बच्चा को भी होता है, शुरू से ही होता है. देखिए जब प्रेगनेंसी में जो ओबिस मदर है वो तो बड़ा बच्चा देते हैं ना, बड़ा बच्चे के बाद क्या हो उसका वेट भी ज्यादा होता है, उसका ओबेसिटी भी होता है। और अभी देखिए हम लोग बताते हैं कि यू शुड स्टार्ट द ब्रेस्ट फीडिंग, सी इनिशिएशन ऑफ द ब्रेस्ट फीडिंग शुड बी स्टार्टेड अर्ली, so within 1 hour of the birth. So breastfeeding should be continued at least for 6 months for exclusive breastfeeding. After that, continuation of the breastfeeding 2 years or after you can. So that will reduce the obesity also. But nowadays, even the many of the mothers, they are working, they have the sedentary habit, they are not taking interest for taking care of their baby. हो सकता है किसी कोई कोई family में, so they are giving the teen feed and other feed, so that causing the increase in the body weight and the होता है, ऐसा हो सकता है। सो बॉडी वेट बच्चा को भी होता है। एडोलेसेंट एज में क्या होता है, वी आर गेटिंग द जंक फूड, वी आर गेटिंग द फास्ट फूड, सो दे आर वेरी टेस्टी। सो होम माँ बताने से भी वो घर का खाना नहीं पसंद करता है, वो बाहर का जो कोल्ड ड्रिंक्स मिलते हैं, जो चिप्स मिलती हैं, जो चनाचूर मिलती हैं, जो रोल मिलती है, जो फ्राइड फूड मिलते हैं, वो बहुत अच्छा लगता है, इसीलिए वो लोग तो ऐसे ही पसंद करते हैं। तो ये जो जंक फूड, जो फास्ट फूड, जो हमारा कोल्ड ड्रिंक्स, ऐसे में बहुत सारे ओजन की फराक हो जाता है। सो दिस इज नॉट a balanced diet. We need an carbohydrate, protein, and fat balanced diet. These are rich in fat, these are rich in cholesterol, these are rich in also the salt that will increasing the body weight of the individuals. So even in the menopausal woman, after the estrogen is very much protective for the heart, and after the when the estrogen is lowered or stopped, that time the women are getting obese. Similarly for the male also, after the andropause, they are also getting weight gain is also been occurring. So it is varying across the age group. There is no, that's the initially we have thought it that it is for the affluent society, particularly for the Western country. They are very much concerned with the obesity. But now we are getting that the low and middle income group of like our developing country like the India, these cases are also increasing and उसका तेजी से बढ़ रहा है.
Okay, so in last of my interview, I just wanted to ask ma'am कि कैसे ठीक किया जाए ये? What is the solution for this problem?
First, we have to identify the underlying cause. Underlying cause is that the person having the sedentary habit, because you know that during the pandemic time, many of the workers, many of the IT sectors and other sector, even the school teachers and also the students, they are confined to room, and that also getting their weight, because only not only for the screening time is increased, but also their food habit also being changed. They are confined to room, they are taking the many types of food, and the consumption of food is also increased, and that also causes the obesity. So unhealthy diet, that is junk food, fast food, and whatever the drinks that is available in the market, that is you have to restrict that food, but you have to confine to the balanced diet, protein, carbohydrate, and fat that is required. You have to take the carbohydrate in, though you have to convert to 60% of the carbohydrate, but we have to include the vegetables and fruits in our diet. Vegetables means green leafy vegetables and green types of vegetables, and also the leaves, green leaves vegetables. Everything you have to include, and all the types of fruit, whatever is available, we have to include in our diet according to the availability and also the seasonal variation. We have to. It's not that we have to purchase the apple for our reduction of the body. It's not. But whatever the food is available, you have to consume that fruits also.
Thank you, ma'am. Thank you so much for this beautiful conversation. Any last message to our audience?
Mm. So this is due to the unhealthy lifestyle and also for the unhealthy diet. So this is the fast food, junk food, and this type of foods are very much important. We have to reduce this type of food, and we have to assess our body weight. Simple measurement by weight in kg divided by height in meter square, that will give us the actual normal body mass index. That will give us the indication that we are in normal phase. If it is more, then you have to restrict this food. It is not for all, but those who are increasing their weight, that have to be reduced in amount.
Thank you, ma'am. Thank you.
Yes.
It is
Thank
really
you.
very informative session. I hope that very soon we will discuss on very next topic. Thank you so much, ma'am, for being with
Thank
us.
you. Thank you.